Dear learners, welcome you all in the course of Immunology BZYCT 141. Basically, it is a elective course and it is for the BSc General programs. Dear learner, my name is Dr. Siaram. I am an Associate Professor, Discipline of Life Science, School of Sciences, IGNOU. Dear learner, today I want to discuss very important topics that is known as the immune system in health and disease first. Dear learner, what is the expected learning outcome of today's session? After finishing of this session, you will be able to differentiate between allergy and hypersensitivity. After finishing of this session, you will be able to discuss different type of hypersensitivity. It is a four type of hypersensitivity are there. After finishing of this session, you will be able to explain various immunological disorder. And after finishing up this session, you will be describe the mechanism of autoimmunity and tolerance. And finally, you will be able to explain the various diseases arising from autoimmunity. Dear learner, my session is divided into two parts, part first and part second. In part first, we will discuss the hypersensitivity. How can classify the hypersensitivity? It is a four type: type 1, type 2, type 3, type 4, and I will also discuss the immunological disorder. So basically it is a two type: organ specific immunological disorder, in this case the various organs which are involved. Another is the systemic immunological disorder. In part second, we will discuss the systematic immuno disorder, and in this session, in part second, I will also discuss the various autoimmune diseases, and finally we will discuss the primary immune deficiency and secondary immune deficiency. In this in secondary immune deficiency like malnutrition and environmental factors and various diseases caused by the microorganism, and we will discuss in part second. So I want to discuss one by one in part first. And in part first, what is the hypersensitivity? The excessive immunological response against the foreign or self antigens. In case of hypersensitivity, there will be excessive immune response against the foreign or the self antigens. Self antigens which are present inside the body, and foreign antigen, it may be bacteria or it may be virus or it may be fungi or any other type of microorganisms are there. Allergens are there which are present in the flower basically. The term allergy was coined by the Clements von Perquit and often used the synonymously with the hypersensitivity. So you can say the allergy and hypersensitivity, it is a synonymous word. And Clements defined allergy, it is the altered state of the body immune response or the foreign antigens. And but now allergy is known to be type class of the hypersensitivity. I have already discussed it. It is a four type: hypersensitivity first, type second, type third, and type 4. Immunological response are harmful and cause the serious injuries to the tissues, leading the various disease like Hashimoto syndromes are there, and by a lot of number of the disease which are caused by the altered immunological response. It means immunological response would not be very good. Another thing I want to discuss the classification of the hypersensitivity. We can classify the hypersensitivity into four groups. First one is type first, type second, type fourth, and type thirds. And basically in hypersensitivity there are the two components. The first component start with the initial exposure to allergen known as the initial dose, and the exposure of the allergen of immune response may occur within the few minutes and to 2 days. It is the second response, you can say. The second component start with the damaging effect known as the shocking dose. The first one is the initial dose, another is the shocking dose. It is basically the second component of the hypersensitivity. In Gels and Combs 1963 classified the hypersensitivity into four categories based on the nature of the reaction, what type of the reaction is involved behind this, and the mediator molecules, the number of the mediator molecules which are involved in the hypersensitivity. So I want to discuss one by one how to classify the hypersensitivity. I have already discussed it. It is classified into four ways: type first, type second, type third, type fourth. So I want to discuss the type first hypersensitivity. The type first hypersensitivity is mediated by the antibody. So in this case, the antibody which are involved, and certain class of antibodies are involved, like immunoglobulin E, when they react with the allergen and activates mast cell and basophils. So when the IgEs react with the allergens, it activates the mast cell and the basophil cells, and these cells release vasoactive substance such as the histamines, leukotrienes, and prostaglandins. Prostaglandins, basically the protein molecules are there. The histamines and leukotrienes, basically the cytokines are there. They will release after binding with the antibody to allergen. And allergen, it may be various types, but in this case the IgE which are involved. The type first hypersensitivity shows the clinical symptoms like anaphylaxis, angioedema, and bronchospasm and hypotensions. So these are the various clinical symptoms are there: anaphylaxis, angioedema, and bronchospasm and hypotensions, etc. The type first hypersensitivity is further classified into two subtypes depending on the response of the times. The first is immediate reaction types, and another is the late phase reaction times. The immune reaction occur within few minutes. So after infection, it will respond the hypersensitivity. It includes the release of the vasoactive substances within the few minutes. It involved the reaction, the hypersensitivity reaction which are involved. That is known as the immediate reaction type of the hypersensitivity. First, another is late phase reaction types. The immune response occur after 2 to 4 hours to the exposure of the antigen. It includes the release of the cytokines. In this case, the cytokines which are released, or ultimately they are able to activate the other cells. And you can see in this figure, here is the antigen presenting cells are there. It may be macrophage or it may be dendritic cells are there. It is allergen, they are bind with, ultimately they will process it. They will display the antigens. Here is the antigen presentations. It is a T helper cells are there. T cell helper cell, they are able to recognize the antigens which are displayed on the surface of the antigen presenting cells. It activate to the B cells. It produce the immunoglobulin E productions. Here is the immunoglobulin E, and it will react with the basophils, and basophils release the vasoactive compounds. So these are the reactions are there which are involved in the hypersensitivity type first. Another is the type second hypersensitivity. It is also known as the antibody mediated hypersensitivity reaction, where IgE and IgM are directly against to the cells with the allergen or extracellular matrix. So here is the two antibody which are involved, but in case of the first, only IgE antibody is involved, and while in case of type second hypersensitivity, IgM and IgG both antibodies are involved. And this type of the hypersensitivity clinically associated with the hemolytic anemia and thrombocytopenia and neutropenia, means there is the very less of the neutrophils are there. So you can understand through this figure. Here is the IgG and IgM, they can bind it to the infected cells. Here is the allergen are there. Here is the complement activation will take place, or ultimately they can bind it and phagocytosis will take place. Another route are there. Here is the NK cells are there, and ADCC antigen dependent cytotoxic type of reaction which are involved in case of the type second hypersensitivity. The allergen associated with the cell are quickly bound with the IgM and IgG or IgM, cause the cell lysis by the three ways. So there are the three ways the cell lysis will occur in the type second hypersensitivity. First one is the activation of the classical complement pathway. So in this case, classical complement pathway activate. It involved to the making of the pathogen and the final destruction of the infected cell through the phagocytosis. Here is the classical complement pathway involved. They can bind with the pathogens, so ultimately they will engulf by the phagocytosis through the macrophages. Antibody dependent cell mediated cytotoxic pathway. Here is the another pathway are there. It involved to the binding of antigen coated infected cell through the Fc receptor and killing against to the cell of the NK cell, target cell by the NK cells. Here is the NK cells, they will take very important role for the lysis of the microorganism. And third one is the anti-receptor activity of antigen binding onto the cell surface receptor. It act as the opsonin and enhance the phagocytic activity. So there are the three ways we can the cells, they can our immune system, they can utilize it. Ultimately they are able to kill the pathogens. And it is another, I want to discuss another type of the hypersensitivity, that is known as the hypersensitivity third. So in this case, it is due to delayed clearance of the antigen antibody complex. So I have already discussed it in case of the first IgE which are involved, in case of to the Ig second, IgG and IgM which are involved. But in this case, the type third hypersensitivity due to delayed clearance of the antigen antibody complexes, resulting in accumulation of the complex tissues into the blood vessels known as the immune complex tissues. And type third hypersensitivity cause the activation of the complement systems, and when the antigen antibody complexes will forms, and it can activate the complement system along with the recruitment of neutrophils. So there are the reactions, 2-3 reactions which are involved, or ultimately they are able to kill the pathogens, and neutrophil to the complex through the Fc region of the IgG receptor, and the reaction are clinically associated with the serum sickness and Earth's reactions. So here you can understand, here is the depositions of there, here is the antigen antibody complexes, here is recruitment up to the neutrophil through the receptor involving IgE. Here is the complement systems. So these are the number of the pathways which are involved in case of the hypersensitivity. So here is the depositions, or you can say antigen antibody complexes, they will form or it will activate the hypersensitivity. And it is the type 4th hypersensitivity. It is also known as the delayed hypersensitivity up to the cell mediated hypersensitivity. It is mediated by the lymphocyte, and some other type are mediated by the antibody. So sometimes it is mediated by the lymphocytes and antibodies. Exposure of the allergen activate T cells, and which mediate tissues injury through the monocytes and macrophages. So here is monocyte and macrophages. They can involve, they can bind with the particular allergens. Type 4 hypersensitivity is clinically associated with the Graves' disease, contact dermatitis, and some milliforms, morbilliforms reactions, rash caused by dings. So here is the cell mediated hypersensitivity are there, that is caused by the lymphocytes, and antibodies are there. So you can understand, here is the antigen presenting cell, it is a allergen, you can see it is in yellow color. They will bind to the T cells, they have the receptors, it will recognize, they can give the T helper cell one, it will release the cytokines, and T helper cell again they are able to release the interferon gamma, interferon beta, IL-2, interleukin 2, 3 and 8. They will bind again it, or ultimately they will phagocytize by the your activation of the macrophage will take place, or it will remove. So this type of the reaction which are involved into the type 4 hypersensitivity. The type 4 hypersensitivity can further classified into 4 categories on the basis of the T cell activation and recruited effector cells. Here is the 4 categories. We can classify type 4 hypersensitivity can classified further into 4 categories on the basis of to the T cell activation and recruitment of the effector cells. And type first 4A, 4V and 4C and 4D. So in this case, T helper cell and monocytes are activated, and interleukin 1, interleukin 2 and interferon gamma are involved in case of the type 4th A. In type 4th B, T helper cell which are involved, and eosinophils, basically you know very well it is a blood cells, are activated. So in this case, the interleukin 3 and interleukin 4 and interleukin 5 are involved. In type 4C and CD8 positive cell are activated, and granozyme B and perforin and Fas ligand are involved. In type 4D, CD8 positive and CD4 positive T cells and neutrophils are involved. So here is the cytokines like IL-8 and GM-CSF are involved. So this you can classify it into 4 ways. It is totally based on the T cell activation, the various T cell activation like T helper cell 1, T helper cell 2, and CD8 positive T cells and CD4 positive and CD8 positive cell which are involved, and recruited effector cells, it may be the various cytokines are there like interleukin 1 to 5 which are involved, and various other things which are also involved like granozyme B, perforin, fast ligands, and these are the other various things which are involved into the type 4 hypersensitivity. Another thing I want to discuss the immunological disorder. The various immunological disorder I want to discuss in detail. Our immune system are able to differentiate between the self and non-self entity. So I have already discussed it. Our immune system, they can recognize which one is the self cell or non-self entity. If any bacteria they can invade to the our host, it is treated as the non-self entity. But any infected cell, virus infected cell, they act as a self antigens. They can recognize by our immune system. The main component are antibodies and T cell. They can recognize it. When antibodies and T cell fail to recognize, they generate antibodies and T cell is response against itself. And those T cells that are generated against own cell are known as the self-reactive cells. The number of the T cells are there, they can recognize the own cell, that is known as the self-reactive T cells. In the antibody, they can recognize the self cells, and that is known as the autoantibodies. Here you can understand, here is the B lymphocyte, here is the T lymphocyte. B lymphocyte, here is the autoantibodies, they can produce it. Here is the, it would be against the self antigens. Here is the T lymphocytes, they can produce T cytotoxic cells, it react against to the self antigens. So both B cell and T cell, they will react against the self antigen, that is known as the autoimmunity. Another thing I want to discuss the immunological tolerance. It is a very important mechanism inside to the body. First one is the there are the several tolerance mechanism like central tolerance. Another is the peripheral tolerance are there. So our body ensure the removal of the such self reactive cells, that is known as the tolerance. If any self reactive cells are there inside to the body, it need to remove, that is known as the tolerance. And during maturation of the B cells and T cells carrying the self reactive receptors or antibodies are eliminated, that is known as the central disorder. So it is a very important mechanism. It will act as a self-guard of our bodies. You can say it is the central tolerance are there. In this case, your various cells, they have the self-reactive receptor are there. It would be eliminated through the various recruitment. However, this eliminate is not absolute, and some self-reactive escape in the circulation. These cells trapped and eliminate into peripheral lymphoid organs known as the peripheral tolerance. The activated lymphocytes have short span and they ultimate die by the apoptosis. It is a safeguard of our body. So these are the very important mechanisms are there, that is known as the immunological tolerance. It will remove the self-reactive cells. It will work as the central tolerance as well as the peripheral tolerance. So ultimately our self-reactive cell would remove from to the body, then autoimmunity will not take place. When the tolerance mechanism fail to protect the host, it lead to severe or fatal organ damage. Such condition is known as the autoimmunity. The term autoimmunity was first used to the Paul Ehrlich and to describe the cell toxicity. Many type of autoimmune disorder related to the different tissues like muscles, bone, skin, lungs, nervous system, thyroids, intestinal tract, and blood related autoimmune disorder are there. There are the many type of autoimmune disorder are there. The autoimmunity can be classified into two types. One is the organ specific autoimmunity, another is the systemic autoimmunity. So I want to discuss one by one. I will finish the organ specific immunity in part first, and part second we will start the systematic autoimmunity. I want to start the organ specific autoimmunity. So what is the organ specific autoimmunity? The condition arises when the humoral or cell mediated immune system target only the particular antigen of a single organs. So here is a number of the organs are there, like thymus are there, here is the kidney are there, and liver are there, various organs which are available inside to the body. Even intestines are there. The they can develop the autoimmunity, and it is not only effect to the normal functioning of to the organ, but also causes the physical damage. And in most cases, the damaged tissues of the organs from the self-reactive component are placed by to the connective tissues, leading to the fibrosis, and sometimes antibodies stimulate or antagonize into the normal function of a particular organs. So these are the various organs, organ specific autoimmunity, like it depends on the thymus are there, and intestine are there. So various organs which are involved, they are able to develop the autoimmunity. And I want to discuss one by one. Here is the organ specific autoimmunity diseases. First one is the Graves' diseases. So you can understand, here is the thyroid glands are there. The condition arises when the productions of the thyroid hormone. In this case, here is the normally the autoantibody bind to the receptors of the TSH on thyroid cells, and normally TSH bind to the receptors or produce adenyl cyclase that signals are secreted in the thyroid hormone T3 and T4, and this lead to the unregulated stimulation of the thyroids and produce the uncontrolled secretion of the thyroid hormone. So ultimately, basically it is a autoimmune diseases. Here is the autoantibody, they will generate, they will bind it, or ultimately your thymus gland, they will not function well. Another is Hashimoto diseases. In this case, the autoantibodies and sensitized T helper cell start to the target, and the thyroglobulins and thyroid peroxidase. The presence of autoantibody T cell and lead to the type 4 hypersensitivity recruited plasma cell and macrophages, lead to destruction of thyroid cell, and from the germinal center and lymphatic follicular result hypothyroidism. And another is the good posture syndromes. So you can see it here is the inflammation and bleeding will take place. Here is autoantibody generated against to the lung cells. Here is the auto antibody they be generated against to the kidney cells are there. Here is the hematuria. There is the blood and urine will release. You can say it is a good posture syndromes. And Myasthenia gravis. Myasthenia gravis, here is the autoantibodies is not block only the acetylcholine bind which are necessary to stimulation of muscles, but include to the activation of the complement cells. So here is the no muscle activation will take place after generation of to the autoantibody. And another is the autoimmune anemia. So here is there are the two autoimmune hemolytic anemia, they will generated. Another is the Parcinius anemia are there. It is due to the deficiency of the vitamin B12. They are not able to autoantibody, they can bind with the particular receptors, or they will not absorb to the B12, or it will create the anemia inside to the body. Dear learner, I want to summarize my part first. Hypersensitivity start with the initial exposure of the allergen known as the initial dose. After exposure of the allergen, immune system response result in damaging effect known as the shocking dose. Gell and Combs in 1963 classified hypersensitivity into four types: type 1st, type 2nd, type 3rd, type 4th. And when all the tolerance mechanism break down and fail to protect a host from its own immune system, it lead to severe and fatal organ damage that is known as the autoimmunity. Autoimmunity disorder can be specific of an organ, it may be affect multiple organs. Dear learner, I want to take a short break. Don't go away, we will come within 2 to 3 minutes. Dear learner, welcome, welcome you all in the part second. In this part, I want to discuss the immunity. I have already discussed it, the immunity, systematic immunity. The systematic immunity is a state of immunity, state of autoimmunity where the immune response targets vast range of tissues and organs. So here is the various organs which are involved in case of the systematic autoimmunity. Not only target single antigen but multiple antigen present across the organs, and hence the widespread damage across multiple tissues or organ occur from the autoantibodies and cell mediated immune response. There is a dysregulation of immune system and inappropriate inflammatory response. So that is known as the systemic autoimmunity. In the some systemic autoimmunity diseases, here is the systemic lupus erythematosus, SEL, that is known as, it is a very dangerous disease are there. Basically it is a autoimmune disease. You can see in this figure lupus will be generated on the surface of to the body. In systematic lupus erythematosus is autoantibody target wide range of tissues including RBC, platelets, clotting factor, leukocytes and histones. So here is autoantibodies. They are able to target the various tissues including RBC, platelets, clotting factor, leukocyte and histones. It causes the inflammations. After binding with these particular tissues, they cause the inflammation of the connective tissues and provided the flexibility and strength to the body like cartilage, blood vessels, etc. The individual with the systematic lupus erythematosus shows the symptom of the arthritis, skin rashes. You can see here the lupus will form, that is known as the skin rashes, kidney dysfunction and fever and weakness. And systematic lupus erythematosus is more prevalent among women of the Hispanic origin and American African who are in age group of 20 to 40 years. And the delayed clearance of the complex induced type 3rd hypersensitivity reaction is a activate complement system and inflammation of the wall of the blood vessels. Elevated activity of complement system can induce the aggregation of neutrophil through CR3 complement receptor. Here is a very important receptors are there. They can activate it. The elevated up to the complement systems. In the autoantibody targeted RBC platelets can lead to the formation of immune complexes and activate complement system. And eventually the complement mediated lysis of RBCs and platelets lead to the hemolytic anemia and thrombosis respectively. Another very important autoimmune diseases like the multiple sclerosis, that is known as the MS, multiple sclerosis. It is a inflammatory diseases that exclusively affected with matter of the central nervous system. You can see here is the CNS are there, central nervous system are there. In the multiple sclerosis, autoreactive T cell attack, the myelin sheath, you can see here is the myelin sheath are there. Here is the nerve cells on the surface of the nerve cells, the myelin sheath which are bind on the surface of to the nerve cells, and they will react with to the autoantibodies and leading to the demyelination and neurological disorder. So you can see it here is the nerve cells are there, or it is deformated. Your myelin sheath, it will deformated. The activated autoreactive T cell from the blood circulation can also enter into brain and cause the lesion. The multiple sclerosis is one major neurological disorder, especially to the western country, prevalent in men and women from 20 to 40 years. And third one is, it is another autoimmune disease that is known as the rheumatoid arthritis. It is again it is inflammatory diseases affected mainly the hands and feet joints. So you can see it is the arthritis are there, rheumatoid arthritis. It is due to the autoimmune diseases. So in this the autoantibodies are generated against to the IgG in the Fc receptor. Here is immunoglobulin G antibodies are there in the receptors. They will bind it. The auto antibodies are IgM immunoglobulins, and they are referred to the rheumatoid factors. And the autoantibody IgM molecule from the complex with the IgA and accumulate into the joints. So various joints are there. These autoantibodies and IgM, they will accumulate it. Ultimately deformation will take place. This delayed clearance of the IgM and IgG complexes ensure type 3rd hypersensitivity reaction. It also activates the complement system that lead to chronic inflammation of the joint, cardiovascular, respiratory and hematological system. So you can see in this figure, here is the hands joints are there. It is a hand joints are there. You can see the deformity are there. It is due to the IgM and IgG complexes. It will accumulate in particular joints. Ultimately your hands joints will not function properly. That is known as the rheumatoid arthritis. Another thing I want to discuss, the immune deficiency. The various immune deficiencies are there, like primary immunodeficiency and secondary immunodeficiency. The immune deficiency is a state where ability of immune system to fight against the infection is compromised partially or totally. It is also known as the immune compromisations. In this case, the individual become more vulnerable to the opportunistic infection than others. Such individuals are said to be immunocompromised. The immune deficiency is divided into two categories. First one is the primary immunodeficiency, second is the secondary immunodeficiency. So I want to discuss one by one what is the primary immunodeficiency, another is the secondary immunodeficiency. The primary immunodeficiency. The primary immunodeficiency is known as the congenital immunodeficiency, where the immune system of an individual is weak or does not function normally from the birth. The most primary immunodeficiency are diagnosed in the children under the age of 1. Those suffering from the primary immunodeficiency shows the persistent infection and autoimmunity disorder of the various organ. And primary immunodeficiency disorder are genetics in nature. So you can see here is the the lymph nodes are there, appendix are there, and lymphatic vessels. These are the the primary immunodeficiency diseases are there. They can cause into the various organ inside to the body. The type of the primary immunodeficiency order, it is divided into 5 types. First one is the B cell deficiency. So I have already discussed in my previous lecture what is the B cells, what is the role of the B cells. Here is the B cell deficiency inside to the body. So basically it is a X-linked agglutinuria or to the Burton's diseases. X chromosome link disorder. Pre-B cell do not differentiate into mature B cells. In this case, in this disorder, and maturation of tyrosine kinase encoded genes which are involved, they will defected, and all the IGs present into the IOX label. And second is the selective immunoglobulins IgA deficiency of the IgA in this case, and malfunctioning of the heavy chain switching. The heavy chain switching will not take place if this type of deficiency occur, and prone to the lung infection and recurrent sinus will be there. It is a very important disease. The prone to the lung infections like pneumonia are there due to the deficiency of the B cells. Another is the T cell deficiency. The T cell deficiency, you can see here is the, I have already discussed it, the T cell which are generated in the bone marrow but mature in the thymus. If the T cell deficiency will take place, so you can see here is the Dye-Jarre syndromes will occur in the babies. Here is the deformation will not take, deformation will be here inside to the mouth of the particular baby. So here is the T cell deficiency is congenital thymic epilepsy or Dye-Jarre syndromes, and tetanic seizures prominent are there, prone to the viral and fungal infections. If the person they are the T deficiency, it will be prone to the viral and fungal infection. Treatment through the fetal thymus transplantation. In chronic mucocutaneous candidiasis, the selective T cell function defect. If the T cell deficiency will be there, the particular person they will suffer from the particular disease like candidiasis. T cell response and other microbes but not candida. But B cell response normal. Here is the T cell deficiency are there, but the B cell response it would be very normal. And hyper IgM syndrome, it is a third type of the T cell deficiency, and the very high level of IgM but IgA, IgG, IgE, IgD defective, but the lymphocyte count would be normal, and compromised B cell and T cell immune cooperation will be there. So it is a T cell deficiency. They can cause the different type of the diseases inside to the body. And third one is the B cell and T cell deficiency. So sometimes both cell, B cell and T cell, they involve deficiency inside to the body of the human. Here is the severe combined deficiency diseases, SCID diseases are there. Early stem cell fail to differentiate into B cell and T cell, and prevalent deficiency of the IL-2 receptors, and defective Janus kinase 3 and JAF70 genes, defective immune cell receptor RAC1 and RAC2, characterized by the variety of the infections are there. If the variety of the infection will take place, it need to check it the IL-2 and the JF70 genes, their up regulation and down regulations are there. We can check it, or ultimately we can decide if the particular person is suffering from SCID disease or not. And Wiskott-Eldridge syndrome, here is reduced IgM concentration and elevated levels of the IgA and IgG levels. A normal T cell population but reduce the function, reduce effect in polymerization. MSC deficiency and Weir leukocyte syndromes. So here is the low CD4 positive and CD8 positive cell count, and impaired antibody productions and bacteremia. And phagocytic deficiency, it is chronic granulomatous diseases, X-linked disorder, and defective NADPH formation of the granuloma, and blockade of the esophagus stomach or bladder due to the granuloma. And leukocyte adhesion deficiency syndrome, autosomal recessive diseases, basically this type of the syndromes are there. And defective phagocytosis of the bacteria, they are not able to the phagocytize the bacteria, impaired the cell adhesions, cell adhesion will not take place of the cell to cell adhesion, and pyrogenic infection like pneumonia will take place. And fifth one is the complement deficiency, the hereditary angioedema, the autosomal dominant disorders. In this case, the causative factor due to the deficiency of the complement protein C1 and formation of the edema on the surface of to the body. And recurrent infection, deficiency of complement protein, I have already discussed it, the pathway of the complement proteins are there. Here is the C3 and C5. C3 and C5 complement protein, it would not form, so ultimately recurrent infection will take place. The particular person would be susceptible to the bacterial infection. Autoimmune disease, deficiency of the complement protein C2 and C4, and similar to systematic lupus erythematosus will take place. So it is due to the complement deficiency inside to the body, they will suffer with the particular infections. Another is the secondary deficiency. Secondary immunodeficiency are there. It is known as the acquired immunodeficiency. The secondary immunodeficiency is more common than the primary immunodeficiency disorder, and the secondary immunodeficiency disorder impairment immune system resulting from the malnutrition, infectious agent, metabolic disorder, and medications, and fifth one is the environmental factor. So these the number of the things which come under to the secondary immunodeficiency. So I want to discuss one by one. First one is the malnutrition related secondary immunodeficiency. In the early age, malnutrition causes the quasquare and meramus, which individuals are underweight in muscle wasting. The thymus gland, where the maturation of T cells occur, are often atrophic. In severe malnutrition cases, it reduces the production of the thymic hormone. Consequently, CD4 positive T cell differentiation and proliferation are reduced. Means the CD4 and T cells will differentiation, it will reduce. They will not recruited by the particular APC, antigen presenting cells. However, the production of antibody is not affected, but to the ability of the B cell and antigen process is compromised. Their neutrophils, polymorph, and nuclear leukocytes and natural killer cell do not function normally. So it is due to the malnutrition, means nutrition which is not maintained inside to the body, they can create the immunodeficiency. Here is the CD4 positive cell, and T cell differentiation and proliferation will not take place very well. They can cause the disease. So it means the nutrition is very important. It will need to take in the proper format. And second is the infection related secondary immunodeficiency. The bacteria, fungi and viruses cause the impairment of the immune system. They can reduce the immunity inside to the body. The Mycobacterium leprae cause the leprosy is observed to be closely associated with the abnormal T cell immune response. The virus like measles virus and cause the impairment of function of the B cell, T cell and NK cells. Cytomegalovirus attack macrophages, rendering inability to process the present antigens. So these are the various infections are there, various viruses which are involved, like bacteria, Mycobacterium leprae which are involved. They will generate the secondary immunodeficiency. AIDS is classical example of the secondary immunodeficiency. Acute depletion of the CD4 positive cell count and low CD4 and CD8 ratio is observed in case of the secondary immunodeficiency. So we can measure it, the macrophages, we can measure the CD4 positive and CD4 positive and CD8 positive ratio, it would be observed, and we can decide it is due to the infection related to the secondary immunodeficiency. And third one is the drug related. The various drugs are there, like corticosteroids and calcineurin inhibitors and cytotoxic, various cytotoxic drugs are there used in the immune response. And the corticosteroids reduce the production of the TNF alpha, interleukins 1 and interleukin 6 impaired chemotaxic cell adhesion, phagocytosis properties of the leukocyte. It is a good inflammatory drugs and reduce the tissues damage against the infection. Calcineurin inhibitor drug mostly used to prevent the organ graft rejection. It inhibits the activation of the IL-2 transcriptions and T cell responses, rapamycin protein, which are important to the cell activation and proliferation. And third one is the aging related secondary immunodeficiency. Immunity is individually affected by the aging. The size of thymus gland decreases annually by 3 after reaching puberty till middle age. Then after size of the gland reduced by 1% annually. So the adult life thymus produce fewer T cells. The T cell pool maintained by the peripheral proliferation of the cells. Impaired neutrophil, macrophages, NK cells activity leading to the immune deficiency has been observed into the old age. And fourth one is the environmental factor. The various environmental factors are there, like ionizing radiations, heavy metal, pesticides can cause the secondary immunodeficiency disorder. Continuous exposure of ionizing radiation weaken immune system and affect all blood cell lineages. However, ionizing radiation such as the phagocytosis and humoral response are observed to be resistant against the radiations. And immune response such as the phagocytosis and humoral immune response are observed into resistant against the radiation. Exposure of the lead, cadmium and mercury through the food and water shows the decreasing polymorphonuclear phagocytosis. Phagocytic activity reduce the antibodies and complement response. So these are the environmental factor related secondary immunodeficiency. The dear learner, I want to summarize the part second. You have learned number of the things. I want to discuss one by one. The systematic autoimmunity is a type of immune response that target vast range of the tissues and organs. Hence, widespread damage across the multiple tissues or organ from autoantibody and cell-mediated antibody. You have also learned the immunodeficiency is a condition where the ability of the immune system is fight infection is compromised. It is a two type of the immune response, primary immune disorder and secondary immune disorder. In case of the primary immune disorder is also known as the congenital, where the individual has the inherent and weak immune system, and secondary immunodisorder is also known as the acquired immunodeficiency is an individual may acquire from environmental factors such as the infection or the chemotherapy or malnutrition. Dear learner, if you want to clarify each and everything, you can go through IGNOU SLM BZYET141. You can go through the unit number 13. You can clarify each and everything. If you feel any problem, you can mail me on the crm1@ignou.ac.in. Thank you. Best wishes to you.